Welcome to Costa Rica. My name is Johnny from Johnny Knows Costa Rica, and today we're going to talk about the process to be seen medically through one of the urgent cares called an Ebais. Once you register through the system and you are assigned to an Ebais, this is a process that is done after you complete being submitted into the socialized healthcare system in Costa Rica. Then you get the great pleasure of having to experience this. And you might say, you know what is Johnny talking about? Well, I'm going to tell you. What it is that when you want to go into this system, the Ebais, which is an urgent care center, you either have to do it one of two different ways. You go in through a system called EDOS and digitally request an appointment that's available, and it's usually done a day or two before the actual appointment is done. If you're able to get in the system, typically the appointments start at 5 in the morning open. Log into the system and see if you can grab an appointment. If you're not able to do that, this is what happens. You show up 5 in the morning, like I'm going now, and you wait in line. You wait in line to get a number. Think of it as like a manual number to get to see the doctor. Now, this number and this line that I'm talking about is a manual system. Now, this manual system, it has priorities. So those of you that are seniors, when you do go down and get this number, you do have a priority. Being that I'm a little bit younger, my priority is down. So I may be able to get a number at 7 in the morning, but my number might not come up until 2 o'clock. Expect that. Sometimes this happens, so it's just the system. So just know when you or yours needs to see the physician or urgent care that you're gonna wait. Unless you got lucky enough through the digital system, EDOS, to get an appointment prior to going. So this is things that when you're thinking about the system here, and it's a beautiful system because of the health care that provides for everybody, you're going to have to wait. So I'm going to show you, I'm going to come in and you'll see the number, and you'll see how it happens. And this happens differently in different places. Some places have more people waiting in line, so you may take longer to do things. Some places a shorter line because of the amount of people that are doing it. Now, remember that these Ebaises are, think of it like a territory. In a city, this Ebais takes care of a certain amount of population depending on where you live. If you live 50 meters to the left or 50 meters to the right, you might go to one or other Ebais which are set up throughout the country. Now, these Ebaises, it's territory, so you're going to have to take a bill and have that analyze, okay, you know what, I'm part of this one. So, like I said, you have to be assigned to one before, because you don't know if you are that. Now, they're not going to turn you away, but they may not take you initially unless you're very seriously, and then they're just going to do is send you to an emergency. An emergency is actually even longer than this, so just know that the system isn't perfect, but it's a good system for those that need health care. I hope this information was good for you. My name is Johnny from Johnny Knows Costa Rica. Pura vida.